Hello, welcome to Lesson 2. In our first lesson, I introduced mindful breathing. Today's practice is another opportunity to strengthen your noticing skills. Like the first practice, this is a tool you can use anytime, and I'd encourage you to come back to it as often as you'd like. Noticing is the key to mindfulness. To notice something means we have to pause and bring ourselves to the moment. When we are noticing our breathing, for instance, we have to be in this moment. We cannot be in a future or a past moment to do this. When we pause and notice, we allow ourselves the opportunity to choose how we respond to our pain. Through this noticing practice, we can reduce our judgment of our pain, our resistance to it, and our tendency to use any means possible to escape it. When we become more aware of what we are actually experiencing without judging it, the overall impact of our pain can be reduced. It's natural that when we feel pain, we want to resist it. We don't want to have it. We don't like the way it feels, and we want to change it as soon as we notice it. It's common to want things to be different, especially with pain. There are many ways that we use to distract ourselves in an attempt to escape from the present moment, especially if pain is involved. What we might come to realize is that trying to escape from the pain is a form of denial and resistance, which in the long run may not help. Confronting pain after a surgical procedure is expected and unavoidable. When we hear a smoke alarm, for instance, we have to look for what might be causing this to happen. We have to acknowledge and accept that alarm as a message that requires action. Pain is also a message. We can learn to look at our pain as an expected part of our experience with a surgical procedure. So the question is, what if we could respond differently to our pain, knowing that it's expected? What if we could open ourselves up to the pain? What if we welcome it, knowing that we might learn something from it? If we instead look towards our pain or discomfort, we may find that over time the pain has less of an effect on us. Pain is a stress response. The body and mind experience pain in ways that are similar to how they experience chronic stress, for example. Pain impacts stress, and stress impacts pain. There's a strong link between the two. With both pain and stress, we can experience a rapid heartbeat, quick and shallow breathing, muscle tightness, and even difficult thoughts. This is often referred to as the fight, flight, freeze response. Using mindfulness approaches reduces our fight, flight, freeze reaction and allows us to respond in a calmer and more accepting way. Mindfulness directly targets these stress reactions and weakens their impact on our body. Pain is a sensation, which means it is an interpretation made by the brain before it is consciously felt. Thoughts and emotions flowing through our mind, both conscious and unconscious, have a dramatic effect on the intensity of our suffering. So when we consider this idea of suffering, it's important to note that suffering occurs on two levels. First, there is the actual unpleasant sensations felt in the body. This is known as primary suffering. This often arises from an injury, illness, or some damage to the body. The second level of suffering is referred to as secondary suffering. This is made up of all of the thoughts, feelings, emotions, and memories associated with the pain. Secondary suffering might include anxiety, stress, worry, depression, and feelings of hopelessness. Secondary suffering arises from the mind's reaction to the primary pain. Secondary suffering can also be seen as our resistance to pain. The saying, "What we resist will only persist," is an important one to remember here. What this means is that if we resist the messages that our mind and body is sending us, those same messages will keep pushing against us until we notice and accept them. This is true for not only pain, but also our thoughts, feelings, emotions, and memories. So the pain and distress that a person actually feels is a combination of both primary and secondary suffering. And what we know is that secondary suffering tends to decrease when we observe it. So let's begin today's practice on noticing by first settling into a comfortable sitting position. If possible, sit with your back straight yet relaxed in your chair. And if you need to lie down for this exercise, maybe with one or both legs elevated, you're welcome to try that position as well. And when you're ready, I invite you to gently close your eyes. If it's more uncomfortable for you in these practices, you can also just soften your gaze a bit by looking down. The point here is whether your eyes are open or closed, the point is to narrow your focus to reduce any external distractions. So allow your body now to settle in and relax, letting it be supported by the chair or the floor beneath you. As you begin to relax your body, bring your attention to your breath. Become aware of your belly rising and falling as you breathe. Notice the natural movement of your breath. See if you can follow your breath for the entire duration of it coming into and leaving your body. Notice the rhythm of your breath and how your body flows with it. And again, notice the pause between each breath. Recognize that in this moment, there isn't anything you need to do. You don't need to control or change your breathing in any way. Your breathing just happens on its own. Again, during this practice, your mind will likely begin to wander away from your breath. You might also find yourself thinking about or judging this experience. And again, when you notice your mind wandering, recognize that this is a good thing. It means you are paying attention and that you are noticing your mind. When you notice your mind wander, simply acknowledge this and bring yourself back again to your breath. The rhythm of your breath is always the anchor to look for when you get lost in thought and your mind leaves the moment. So pause here and see if you can bring your attention to where in your body you most feel the sensation of pain or discomfort. With your attention resting in this area, see if you can deepen your breath a little. Notice now if you can breathe into and from that location of pain or discomfort in your body. Notice if in your out-breath you can feel a sense of release. In this moment, we aren't trying to get rid of our pain. This practice is about finding a space to rest our attention and noticing how we can become stronger or more flexible in the face of pain, just by noticing it. If this seems too difficult or uncomfortable for you, that's okay too. We are simply noticing if we can look towards our pain. A good image to bring to mind is the example of placing just our toe in the cold water. We might not want to put our whole foot in because it's cold, but we can just sample and feel the water with our toe. We are sampling or turning towards the sensation rather than being overtaken by it. So as you turn towards your pain, notice, what is that like? What does it feel like to turn towards something painful or uncomfortable? Does the pain increase, decrease, or does it remain the same? How about your reaction to the pain? Can you notice how you relate to the pain as you turn towards it? Does just looking at the pain feel different than trying to escape it or resist it? Recognize too that the thoughts and the noticing of our pain is not the pain itself. When most of us feel pain, we often apply a label to it or judge it as unacceptable or bad. And it's our judgment that often increases or creates our resistance, which then can, of course, make the pain worse. Our thoughts about our pain can make our pain worse. Now I invite you to shift your focus a bit, and remember, when this practice becomes difficult, you can always return your focus to your breath. Now, can you shift your mind's focus to where in your body you feel comfortable and relaxed in this moment? Can you notice another area in your body that doesn't feel pain or discomfort? What does this feel like? And notice too if you feel nothing at all. This noticing where in our body we do not feel discomfort is an equally important practice. Pain isn't the only sensation we can feel in our body. And when we identify with only the pain in our body, we are increasing the intensity of the pain. Our bodies and the pain we experience within our bodies is always shifting and changing. And we always have some control over what we can focus our attention on in the moment. As with all things, this noticing practice becomes easier the more we engage in it. Remember, meditation is about being aware of what's happening physically, mentally, and emotionally in the moment, and about relating differently to those experiences. If you were able to bring any awareness to that pain and turn towards it, even for the briefest of moments, you're on your way to developing a new relationship with your pain. Now, as we close today's practice, I invite you to once again come back to your breath, taking a few deep breaths in and out. Again, noticing if your mind wandered away from this practice. And when you're ready, you can gently bring yourself back to wherever you are in the moment and gently open your eyes.